Ethics and ethical standards for doctors in UK. Introduction. We welcome everyone to the presentation on ethics and ethical standards for doctors in the UK. Ethics and ethical standards are critical components of medical practice and are essential for ensuring safe and effective care for patients. In this presentation, we will discuss the importance of ethics and ethical standards for doctors in the UK and provide an overview of key principles and behaviors. Good medical practice. Good medical practice is a set of guidelines produced by the General Medical Council, GMC, that outlines the core ethical principles that doctors should follow. These principles include treating patients with respect, providing appropriate care, maintaining confidentiality, and working in partnership with patients. The duties of doctors, such as providing good clinical care, working collaboratively with colleagues, and maintaining professional knowledge and skills, are all grounded in these ethical principles. Ethical decision making. Making ethical decisions can be challenging, and it is essential for doctors to have a structured process for considering ethical issues. The GMC has outlined a framework for ethical decision making that includes identifying the ethical issue, gathering information, considering options, reaching a decision, and reflecting on the decision. To illustrate this process, we will look at case studies that demonstrate how doctors can apply this framework to make ethical decisions in practice. Professionalism and ethical conduct. Professionalism is a key component of ethical practice and involves demonstrating the values and behaviors that are expected of doctors. The GMC has outlined key values and behaviors such as honesty, integrity, compassion, and respect that doctors should demonstrate in their interactions with patients and other healthcare professionals. By upholding these values and behaviors, doctors can maintain the trust and confidence of patients and colleagues and contribute to a positive and respectful workplace culture. Importance of ethical standards for doctors. Ethical breaches can have serious consequences, both for patients and for the doctor's professional reputation. By maintaining high ethical standards, doctors can ensure that they provide safe and effective care, build and maintain trust with patients and the public, and avoid disciplinary action or legal consequences. It is important for doctors to recognize the importance of ethical standards and to take responsibility for upholding them in their practice. Conclusion. In this presentation, we have discussed the importance of ethics and ethical standards for doctors in the UK. By following core ethical principles, using a structured process for ethical decision-making, demonstrating professional values and behaviors, and recognizing the importance of ethical standards, doctors can provide safe and effective care, maintain the trust and confidence of patients and colleagues, and contribute to a positive and respectful workplace culture. We encourage all doctors to reflect on their practice and to continue learning and growing in their understanding of ethics and ethical standards. You may refer to above for further reading. Let's start with MCQs. What is the core ethical principle of good medical practice, GMP? A. Respect for autonomy. B. Beneficence. C. Non-maleficence. D. Justice. Answer. A. What is the key aspect of medical practice that patients trust doctors to maintain? A. Honesty and integrity. B. Respect for autonomy. C. Confidentiality. D. Beneficence. Answer. C. What is the process for ethical decision-making outlined by the GMC? A. Identify the ethical issue, gather information, consider options, reach a decision, and reflect on the decision. B. Gather information, identify the ethical issue, consider options, reach a decision, and reflect on the decision. C. Identify the ethical issue, consider options, gather information, reach a decision, and reflect on the decision. D. None of the above. Answer A. What is the key value that doctors should demonstrate in their interactions with patients, according to the GMC's guidance on professionalism? A. Honesty and integrity. B. Respect for patients. C. Teamwork and collaboration. D. Continuous learning and improvement. Answer B. What is the GMC's guidance on confidentiality? A. Doctors must disclose confidential information without the patient's consent when there is a serious risk of harm to the patient or others. B. Doctors must maintain confidentiality at all times, except in cases where it is required by law or there is a serious risk of harm to the patient or others. C. Doctors must obtain the patient's consent before disclosing any confidential information. D. None of the above. Answer B. What is the GMC's guidance on consent? A. Patients have the right to make informed decisions about their care, and doctors must provide them with all the information they need to do so. B. Patients must always follow the doctor's advice and treatment plan. C. Patients do not have the right to refuse treatment. D. None of the above. Answer A. What is the GMC's guidance on financial interests? A. Doctors must declare any financial interests they have that may affect their practice or patients' care. B. Doctors can use their position to gain financial advantage without declaring it. C. Doctors must avoid any financial interests that may conflict with their duty to patients. D. None of the above. Answer A. What is the GMC's guidance on end-of-life care? A. Doctors must always provide treatment to prolong life, regardless of the patient's wishes. B. Doctors must respect the patient's wishes and involve them in decisions about their care. C. Doctors must provide pain relief, but may not withhold treatment even if it is against the patient's wishes. D. None of the above. Answer B. What is the ethical principle that requires doctors to avoid harm to patients? A. Respect for autonomy. B. Beneficence. C. Non-maleficence. D. Justice. Answer C. What is the key value that doctors should demonstrate in their interactions with other healthcare professionals, according to the GMC's guidance on professionalism? A. Honesty and integrity. B. Respect for patients. C. Teamwork and collaboration. D. Continuous learning and improvement. Answer C. Thank you for time and attention. Contact information for further discussion or questions.